Kidney injury, kidney damage or kidney failure is generally caused by conditions like long-standing diabetes and hypertension, and acute kidney injury is something which can be caused by infections. But there are other conditions as well related to hematology which can present with acute kidney injury, and if left untreated can progress to chronic kidney damage and irreversible renal dysfunction. The disease that I'm talking about is multiple myeloma, which most oncologists and hematologists are aware of and capable at diagnosing and treating. Now, multiple myeloma is a disease in which the patient may initially present to a nephrologist because of kidney dysfunction, and the nephrologist is usually alert enough to distinguish between acute kidney injury and chronic kidney damage. If an absolutely healthy individual without any history of diabetes or hypertension goes to a nephrologist with acute kidney injury, it is important to work up this patient for multiple myeloma. Now, multiple myeloma is a condition in which there is proliferation of a certain type of blood cells in the bone marrow called plasma cells, and these plasma cells, they can either directly damage the kidneys by infiltration, they can also produce proteins which damage the kidneys, and they can also cause increased calcium levels which can damage the kidneys. So the common symptoms that patients have when they are suffering from multiple myeloma is anemia. They have a low hemoglobin because the plasma cells decrease the production of normal blood. They can present with kidney failure or acute kidney injury. They can present with backache because the plasma cells, they affect bones and they cause bone expansion leading to backache and sometimes even fractures. Apart from that, they can also present with high calcium levels in the blood. Now, how do we treat multiple myeloma? Multiple myeloma is not a bad disease to have, and generally we do not use chemotherapy unlike other cancers in the treatment of multiple myeloma. We use targeted agents and immune therapies. Generally, with these therapies, we are able to get the disease under control, reverse any kidney damage, and give the patient a good response. Now, once the patient has achieved a response, if the patient is young, less than 65 years of age, we offer them an autologous stem cell transplant. In older patients, we just use drugs to give the patient good treatment results and keep the disease under long-term control. Thank you.